Hi, it's Angie Settle with Your Health Done Right. I'm so glad that you joined us today. I'm really excited about our guest. This is something I've been thinking about. I try to plan out guests, a few months in advance, and I've been wanting to have Miss Janice Moss on the show for the longest time. She's a firecracker, and that's not just because of her beautiful red hair, but she is a firecracker. She's here today with me to talk about what she does at Health Right, what she does in her profession overall. And of course, we're going to talk a lot about recovery. Yes. Welcome, Janice.
Thank you for having me, Miss Angie.
So tell me again what your title is, what it stands for, so we can let the viewers know that.
So I am a PRSS, that is a Peer Recovery Support Specialist. It is a person that has done the state certified test and had the proper hours and training to be certified in the state of West Virginia.
That's great. So it's all about recovery today. I know it's a huge topic. I'm sure, with our viewers, that everybody has somebody that they know either in their family or their friend circle, that suffered through substance use disorder. I've had a lot of patients of mine, multiple stints in rehab, and but I've had those success stories too. Those great success stories. I have one I can think of offhand, that probably went 7 or 8 times, but the last time stuck.
Yeah.
And now he's like 3 years, clean and sober, and he's gainfully employed, and he's got has a new baby. So it's always important to remember that, that topic, recovery is possible.
Oh, yes.
Yeah, we do recover. And just tell me a little bit about what you want to in terms of your background and training, and then just kind of go from there, and we'll talk a little bit.
Okay. Well, when I was growing up, my dad was a pagan. That is not the religion, the motorcycle riding gang. And, it was a really hard, growing up childhood. I can remember being 4 or 5 years old, us being at the mall, and he got, arrested by the DEA for, a substance. He did a very long period in jail. I just grew up thinking and being in an environment where, unfortunately, I just thought that's what you did, was use drugs and drink alcohol and sell substances. And then I will not just blame it on that. Yes. Obviously, I grew up and knew that it was wrong and still was in that lifestyle. I ended up wanting to get better. I started out on MAT, Suboxone.
That's medication-assisted treatment.
Yes,
for our
medicated-assisted treatment. And I was on it for about 12 years and tried. The only thing, though, that stuck with me was when I finally went to detox, then sober living, and an abstinence program.
Yeah, and what we do at Health Right, we'll talk about, what I always say is, we don't say this is better than that. And, I'm not a peer recovery support specialist, but generally what I say is whatever works for that person works for that person. It's not always the same mapped out key. There's not a magic recipe for recovery in my experience, and you have more experience than I do. But, some people do great with abstinence, some do success through Suboxone. We do Vivitrol at Health Right, which is a medication that kind of intercepts when somebody uses a substance, it'll keep them from having that response of euphoria or whatever. So there's different mechanisms for recovery, but you're talking about what was successful for you. And again, we've had people successful in all those programs. But go ahead.
Yes, as being trained as a peer recovery support specialist, you are trained that there are multiple pathways to recovery. And, through motivational interviewing with a client, you let them choose that pathway, and then all you do is you support that pathway, whether that would be any kind of medically assisted treatment, MAT treatment, or now, abstinence.
Motivational interviewing, a lot of viewers may not know what that is, but a lot of us in the medical profession, et cetera, will know. It's where you talk to somebody and you kind of let them lead you to the answer. Why do you want to go into recovery? What motivates you to be clean? And you learn more about them and triggers, and it'll kind of help lead you to what some maybe have, faith, and that may be a faith-based program. Some may, you learn that with talking to your patients and clients.
Definitely.
Absolutely.
Yeah, it is definitely important to let them make the decisions, because if you try to force somebody, or if you try to tell them that this is the only possible way, you're just
Right.
building walls, brick ones that are going to be possibly years to tear down for anybody,
Right.
especially yourself if you're still working with the
Well,
client.
that brings something up too that I think is so important. It's so hard. I can't tell you how many people have reached out to me. They have people in their family, they have friends that are suffering from substance use disorder, and they are so fervently wanting them to get clean and to get in recovery because they're so fearful, people's lives are slipping away. And, I try to explain to them, we can want it for them so much, but they have to want it for themselves. How do you work with people to make that understanding, to convey to people that, and it's so hard to know then when they're at that level, because in my experience, I've worked with people, they'll come in, they say they're ready for recovery, but then when you start talking to them, they only go to this kind of program, they won't go to this, they don't want to do that, they can't do this, they can't do that. And it's such a balance between, trying to push people forward to get into recovery versus when they're really not ready.
And this is why peer recovery support specialists took off in the state of West Virginia, and actually all around the country. A person talking with you is not going to feel as comfortable with you about anything that they're going through. But as a peer recovery support specialist, I can sit and actually tell the client about my journey and the multiple times that I tried, and they, from the very beginning, those walls break down, and I'm able to get in by telling them my story, and then build that rapport, and then they in turn start to tell me their story. It's an amazing process, and that's why we totally, absolutely have to have the peer recovery support specialists in our healthcare facilities.
Yeah, I believe that. I think too, if they're kind of just telling the story or telling you what they think you want to hear, you're able to call that out better than I would. You could say, hey, wait a minute, I've been there, I've said that, in my past. Would that be true?
Yes, it's definitely true. I can call them on their stuffs, and a physician, an NP, RN, just anybody, MA, nobody could actually do that and be like, I was there.
Right.
So you can't tell me that is, the way that it actually is.
And I think it's so important in any kind of facet of healthcare, whether it be somebody dealing with postpartum depression or anxiety or anything, when you can relate to that and you can look at somebody and say, look, I've been there. I know what I'm talking about. I've felt the way you felt. You can see their eyes kind of light up and they're like, whoa, she has been there. She knows what she's talking about. I think we do such a good job of putting that healthcare team together.
Oh, we do.
Where we have, psychiatric nurse practitioner or, Dr. Thistlewaite, who's our overseeing psychiatrist. And then we have you as the recovery coach and different people where they all have that little piece of the puzzle. And you kind of surround that patient with that, quilt of care. I always love to say that quilt of care. But, while they can talk and do whatever, and I can say, hey, we do this, we do that, it's just not that same connection as you have with that lived-in experience. And I think it's so important. I don't know who came up with the concept originally or how it was created, but it was ingenious and very smart, I think, because we always have a recovery coach on site, ready, or outreach, or anything like that, because I think it's so important. You may have a nurse or an MP or somebody involved or a psychologist, but to have that peer recovery support specialist who has that lived-in experience that can connect. And even if they're not ready to go in recovery that day, and we know from what we do, it's not always the first day, it may not be the second day, maybe not the third day, but just building that rapport and that trust. So maybe it's 2 weeks from now on a Thursday at noon that they all of a sudden feel like, hey, I'm ready to go in recovery. You've already created that relationship, handed them that card, and said, look, whenever you're ready, come in, call me, ask for me, and we can expedite them and get them into recovery.
It's honestly all about building that hope. So, you know, a lot of us joke in the recovery community, but it's not a joke. We used to be, you know, drug dealers. Now we're hope dealers.
Yeah, that's great.
And it's
like it.
honestly the truth, because the rapport that we build with the client is on hope, is on, I did this, this, and this, and look at me. And they, you know, not look at me,
I got
but
you.
in certain sense, that's what we're doing, is we're saying, you know, this is what I'm doing now. I have a house,
Right.
I have a car, I have a car payment, I actually pay my insurance, and these things, you know, they're like, wow, you know, that's amazing if she can do it, or if that recovery support specialist can do it, there is hope for me.
Yeah.
If she
Absolutely.
went that far down into the madness and in her, you know, substance use disorder, then there is hope for me. And she
Absolutely.
knows the way.
And she can help
you
lead
know,
me
and
out.
she can help lead me out.
Absolutely.
And when we do the detox and when they call and when they are ready, we don't stop there. We make sure that, you know, I make sure they get into the detox, and then once out of the detox, I give them my card. They can call me to get into a sober living home. And then after that, we get them a job lined up. I've been in this 5.5 years, working in recovery. And I have built a lot of resources, a lot of detox resources,
Right.
a lot of sober living home detoxes, a lot of job referrals. If I call a person that runs a Burger King or a person that runs a McDonald's and say, I have a person, they get that job right then
Yeah.
if I can refer them, because they know that, you know, I'm sending them good people. We get them shoes to work in, skid-free shoes, so that, you know, because you have to have those to
Oh,
work
yeah.
in the industry. We get them
Absolutely.
their card. We can get them a $25 voucher to the Goodwill. I write those, and they're able to go and get their work pants. They're able to go get their undershirts, their socks.
The things that you need.
Yes.
Yeah. All
because-
the things a lot of people take for granted, that we're trying to set them up for success. Because it's so much more than that. It's not just going into detox and coming out. You know,
No.
they do require all that follow-up, and the sober living is so important, and that support of you that they can call up, you know, if they're struggling or whatever. It's so important. So talk a little bit about, you've done it a little bit, but about the recovery program at Health Right and how we do that wraparound service and care and follow-up and how that all kind of works. Talk a little bit about that.
All right, so we actually have a program. It's called the HOPE program at West Virginia Health Right. It is a program that has counseling, possibly MAT, which we do Vivitrol at West Virginia Health Right, support groups, one-on-ones for accountability. All these things together and tied together. Even once they get into the sober living
Right.
home, they come to us for these supports, for these extra supports. It is really important, the MAT that we do, the Vivitrol. I actually brought some stuff with me today
Sure.
to
Yeah,
show
go ahead.
actually how it works.
That's great. We love show and tell.
Yay! So we'll go and get that out.
Yeah, that's
Kinda
great.
spilled in my bag.
Yep, that's perfect. And also, while she mentions that, we don't want people to think if you are not interested in Vivitrol or you want to do Suboxone that you can't come to Health Right, because we have these support partners, not against Suboxone per se, but we refer out to whatever program people need.
Yeah.
As comprehensive as Health Right tries to be, we try not to overextend ourselves and get into where we're doing certain treatments and we don't feel like we're doing a good job. So that's something that we feel other partners are doing well, and we, you know, can refer out to them.
Yeah,
For that.
it goes right back to their own pathways. It goes back to motivational interviewing. It goes back to what they want and what we can help them get, because that's what they're going to do. They're not
Right,
going to want what you
absolutely.
tell them.
Absolutely.
But this is actually a model of the brain. Of
Right.
course, we know this is the frontal cortex. And we open this up right here, and this is the limbic system region of the brain. And this is what holds the opiate and alcohol substance use. It's the reward system of the brain. And if we can, I'll just put this back together here if
Sure.
I can. If you can just imagine
It's okay.
I know, right?
It's okay.
I know, I just don't want it to fall in that glass. So if we can imagine a baseball glove, all right, and somebody throws a baseball glove into the baseball glove, it's the same way in the brain with the opiate receptors. There's holes there missing after they stop using the substance of opiates or the substance of alcohol. There's holes in there, receptors. So you put a baseball in the baseball glove, the Vivitrol acts as the baseball and puts a per se baseball into the receptor, and then the receptor is full. And of course, like a baseball, you can't fit two fit two baseballs in a baseball glove, so you can't fit any more into the receptors. So if you would try to use opiates, substance, or if you would use the substance alcohol, there's no room for it to go. And so there's no effect into the brain. So it's kind of an extra cushion for them to be able to have in their recovery as far as, you know, accountability of using. If they use, it's just not going to be effective.
Right.
It's an amazing, amazing medicine, amazing process.
Yes. Yes, that's great. I've never heard it explained like that. That's amazing. So I do know that a lot of people are successful with it. And one thing to talk about is I don't think any program or anything anybody does is successful without the counseling and support part. Would you agree? I mean, it's not, you can't just take something and go. You really got to work the program and have people like you helping us. Talk to me a little bit about some of the classes, the support classes, and that we do, and how that, some of the topics we talk about, and how that supports people in their recovery.
Well, I explain to the client usually that I also am in counseling, and I also go to recovery groups outside of work, that this is not my recovery, and that they need to make that a top priority. So we have individual counselors at West Virginia Health Right to do individual sessions. We have me for accountability sessions, and then we also have groups, recovery groups.
Right.
They're located right now on the West Side, the West Side Clinic.
We have so much construction going on at the main clinic because we're doubling the space, that we've had to kind of get creative in terms of where our classes are at. Eventually, excitingly enough, in June, we have a ribbon cutting schedule for the East End clinic, and we'll go from 15,000 square feet to 30,000 square feet, and the current medical space will be transformed into a complete behavioral health, substance use disorder care area. It'll even have a small group area based there in that space. So we'll be having a lot of changes then. Very exciting. But in the meantime, we're a little bit hodgepodgey, but it's short term.
We are, but we have our Mondays and Wednesdays at 1 o'clock on the West Side location. I do believe it's 511 Central Avenue.
Central Avenue.
Yes.
Right, on 5 corners.
And they're led by our psychologist that we have over there, Krista, and a peer recovery support specialist that we also have on the West Side. We have peer recovery specialists at all of our locations at West Virginia Health Right.
So important, because you never know when somebody's going to come in and they're going to be ready. Or we've had people come in for an earache or something else, and in talking to them, we find out, you know, that they're struggling with substance use disorder.
That's how we get most of them.
And then that's when we kind of back out and say, hey, well, let me have you meet somebody. Let me go get Janice. Here she comes. She's going to talk to you today. So it's really important to do that. It does.
It works.
And that's one of the ways that people, you know, they may not understand how comprehensive places like ours are, not just bragging on us, there's other places that do great work, but, you know, even though somebody comes in, if you're a patient-centered medical home, they may be coming in for their blood pressure, they may be coming in for, you know, that earache, but in that process, we're going to be assessing them for everything else that's going on for their life. Maybe that's the day that they go into recovery. Maybe it's not. Maybe it's 2 weeks later. Maybe it's a month later. But whenever it is, setting that relationship up and being very patient-centered and letting them know that you're there is so important. Something else I want to talk about, because I've heard this a lot from families. We also have support groups for families of people that suffer from substance use disorder, because we know it's not just the person using, you know, people in their family are impacted as well. What would be some of your advice for somebody out there that has a loved one or a friend or somebody, you know, that they care about that's currently in the throes of substance use disorder. And they are just, feeling really desperate, and they don't know what to do and where to turn. What is the best way to support that person, yet not enable that person? And when I say enable, you know the difference. When you're helping them and you're showing support, but you are not enabling them in any way because you love them so much that somehow it's becoming negative, and it's actually pulling away from the fact that they could get into recovery. What's the best way to do that?
I think the best way to do that is I actually brought some stuff with us.
Sure.
I'm going to pull that out. Is the words that we use nowadays. I know that when I was in the throes of my substance use disorder, my family would say things like, you've been a junkie since you were 12. And, that built walls that they were never ever to tear down. I ended up they passed away. I have no family existing now. But, I would not listen. They couldn't do anything with me after that because it would hurt.
Absolutely.
And so the way that we like to do it nowadays, instead of using the word alcoholic, the word drunk, the word junkie, the word user, addict, is we would like to try to use words like, you're a person with substance use disorder, and there's treatment, and there's help, and I know where to get it. These things are super important when we speak to a family or a loved one, not to hurt them and not to build walls. We're trying to get those walls down a little bit, and the words that we use are super important when we're talking to
Very
a person with substance use disorder. It is important to them. It's important to them. We use it. We use the words of comfort and the words that the National Institute of Addiction Specialists, they recommend. We do that in our clinic. A lot of clinics and hospitals are aware of the words.
Yes.
And I think the public needs to be aware of the words too, because this could change the whole outcome on speaking with somebody that you're trying to help with substance use disorder.
I think a lot of people are getting there. I know in my career I've seen it, but historically people have thought it's always about a choice. People brought it on themselves. I mean, this is what, they brought it on themselves. They need to make a decision. I think people have more of an understanding of alcoholism than a lot of times they do with substance use, because people understand that, they've always, somebody's had an issue with it, they struggle with it. Sometimes people will, have a relapse, and then they realize it and they're back. And a lot of times with substance use disorder, they don't give people that same leeway to think, okay, sometimes people do make mistakes and they do relapse, they get back up on their feet and they keep continuing. They're still in that recovery journey. It's not one and done. People sometimes get that. And I feel like we have some growth still to do in that area, to have people say, wait a minute, you need to give the same concessions and empathy that you give people maybe with alcoholism to people that have substance use disorder.
The DSM actually now has said that substance use disorder is a disease and it is treatable. And I had alcoholism for a very long time, but it's just now coming around to the SUD, substance use disorder. This is super important when we're talking about somebody that is in remission, a person that is in remission like me in recovery. That's what I consider myself.
Absolutely.
And when it does happen that they use another substance or they use alcohol again, that there's an understanding that this happens in other diseases also.
Absolutely.
If you have cancer and you're in remission,
absolutely,
the cancer possibly can come back. You have to go get checked, and if it would, then we would need treatment again. This is the way that people and the public, of course, us at our clinic, we understand, but the public need to understand.
Well, and I think some people can understand. This is something that a lot of people know about is diabetes. There's type 1 diabetes where, the pancreas totally shuts down altogether and they have to go right to insulin. There's type 2 diabetes that sometimes there's lifestyle modifications and weight loss. And they may take oral medications. They may end up eventually on insulin, but they may not start there. But, you hear about people that are diabetic that are, really faithful with their diet and they're being really strict, but, they go somewhere and they go to a birthday party. I'm not saying that you can't ever eat cake, but I'm saying they see other people and they kind of get down and out and they think, oh, and they might have a binger in a way of eating sugar and doing things they shouldn't. And then they are like, okay, I need to be, this isn't good for me. I need to be better. People understand the struggles that people have with that and the struggles with diet and things like that, and they give people, or with tobacco use, you understand. I've had patients that, didn't use tobacco or whatever, smoked for a long time, and then they quit, and then somebody dies or something happens, or they're at an event and they say, well, somebody was smoking and I thought I could just smoke one. And then the next thing you know, they're back on 2 packs a day, because you have to understand that person, you can't, it's like an all or nothing, you can't use a little bit, you can't smoke a little bit. And that's a process that people go through, but people often have more understanding of tobacco use and smoking how that happens than they do for people with substance use disorder. And I think people really need to look at that and check themselves and think about that, because it's all, like you said, it's all disease. Everybody has different triggers and things that go on, and we need to understand that it is a process. If somebody does have a relapse, you don't write that person off and say, well, that's it, they're done. No. It happens with a lot of conditions, and I think it's important that not that you're giving people an out or you're giving people, a license to go use, but because of the fact that it's a normal part of the recovery process, and you set people up and, the understanding that you don't give up on people.
No.
That it's a journey, it's a lifelong battle, but it can be one great experience with people like you, people that we see every day, other recovery coaches, and how we help people do that.
We definitely want to love the loved one or the family member that is in using, again, the substance that they were, that they had a problem with. We definitely want to not enable them.
Right.
But we want to love them and let them know that it's okay that they did. And we need to explain to them with situations like you just did, with diabetes, with alcoholism, with smoking, with things that it's the same thing. You have a disease, a disorder, and it's okay, and you can get back on track, and that as a family member, I will help you, and it's okay. These are definitely ways that we want to act instead of building those walls, instead of being like, well, we knew it, or how many times have you done it before?
Absolutely.
Or these build walls.
They do. And then when they really need you,
and they want to use more.
Right. And then when they feel like they really need somebody, they won't come to you for sure. We're about ready to wrap up, but I want to make sure that we have phone numbers for people. If you're either, if you have somebody in your family you want to connect, or you yourself are struggling with substance use disorder, we want to give you an avenue. You can call Janice, talk to our staff. What's a good phone number, Janice, for people to call?
So I made sure that I brought a piece of paper so we didn't get it wrong. 304-414-5920 is my office number, 414-5920. And I have a cell phone that's provided with West Virginia Health Right. I take that home with me and I do answer it. 304-415-6358. 415-6358.
Perfect. Well, that's all the time we have today, Janice. I appreciate you coming on. It's so important. We can't talk about this topic enough. I plan on having you back again, because we could do another episode just on this. But thank you so much for coming in, and thanks for sharing your journey as well.
Well, thank you so much for having me and giving me a safe place to fulfill my purpose in life and to help others and lead them into the path of recovery and remission in their substance use disorder.
Thank you. We love you, Janice.
Love you too. You're great.